I got into ophthalmology because it's a very precise field with a lot of high tech, which I enjoy, and we can really help people. We can cure people, and there aren't that many fields of medicine where you can really make someone much better than they were and cure disease. So it's very gratifying that I can have patients who don't see well, and when they leave me, they see much better and have a renewed outlook on life because of that. The eye has two real parts that are responsible for focusing light rays, a cornea and a lens. As someone gets older, the focusing ability of that lens becomes harder and firmer. After a lens becomes harder and firmer, it can actually become yellowed and darkened, or parts of that lens can develop obscurations which prevent those light rays from coming in adequately. And so that really is a cataract. It's not something alien to the body, it's the body's own natural lens, the eye's own natural lens becoming clouded, darkened, brown, preventing light from getting in to the retina to be processed by the brain. And so when that happens, there really is no solution except to remove that cataract. There's no drop. The cataract has to be removed if somebody wants to see better. And we have the technology to make people see better in their older years, and that's why we do cataract surgery. When a patient comes to the SE surgical facility, they check in the front. We confirm all the necessary information about their medical history and insurance information and what exact procedure we're doing and which eye we're doing it on. And then they're taken into the dressing area, then are brought into our preoperative area. They'll meet an anesthesiologist who will be giving them an intravenous line for some mild sedation. And after that, they're brought into the operating room. The patient's completely monitored at all times. They have oxygen, they have cardiogram monitoring, and there's a nurse devoted to make sure that that patient is healthy and doing well. I then will come into the room and perform the cataract surgical procedure, which usually takes anywhere from 5 minutes to 20 minutes, depending upon how thick the cataract is and how complex the surgical procedure is. When we're done with the procedure, the patient will then leave the operating room, wheeled out in a reclining chair to the post-operative area. Post-operative area, patient can have a cracker, some juice. A nurse will go through their post-operative instructions and medications, paperwork, their follow-up appointment. And then before the patient leaves, I will come over to the recovery room, make sure the patient's okay, take a look at the eye, make sure that everything's intact. And if I say that things are clear, then patient can go home, and we'll usually see them the next day either in our office or one of our affiliate offices. And that's the pretty much normal routine of cataract surgery here. Whenever you remove a cataract, you have to replace the natural lens with an artificial lens. That implant lens stays for life, doesn't have to be maintained. It's not like a contact lens, it never comes out of the eye, doesn't have to be cleaned. There's nothing that a patient has to do about it. Now, there are some options for this artificial lens. The vast majority of people will choose a lens that allows them to see relatively clearly in the distance, but wear reading glasses to read. That implant lens is the standard lens, and that lens is covered by most insurance plans. There is an upgrade optional lens, which is known as a multifocal, which allows you a patient to see both distance, intermediate, and near. And so it doesn't eliminate glasses completely, but minimizes the need for glasses. Another option is that people have astigmatism. If there's an irregularity or a ripple in the cornea, that's astigmatism. It's not perfectly smooth. And so we can compensate for that ripple in a glasses prescription, in a contact lens, or even better, built into the implant lens that we put in after cataract surgery. So for people with astigmatism, they can have an astigmatism implant lens called a toric lens. So we'll customize what we can to make a person happy and to make them comfortable, depending upon the patient's individual needs. Cataract surgery patients need to be seen the next day. If somebody were to develop an eye infection after surgery, we need to know about it soon because there are no blood vessels inside the front part of the eye, so there's no way for an antibiotic to get in there that well. Now, it doesn't have to be us. It can be your referring doctor who sent you in for the cataract surgery, or it can be one of our affiliate doctors. Typically, after that visit, you'll be seen a week later, and then maybe 2 weeks later after that. You'll be using drops. You'll be using an anti-inflammatory drop and an antibiotic drop for about a month. The other major issues in terms of activities, what can you do and what you can't do after cataract surgery? I use the smallest possible state-of-the-art incision size, which is only 2.2 millimeters. With that size, you can pretty much go back to your full activities the next day. For the most part, you can go back to work, you can go to do aerobic activities, you can do almost all your activities starting the next day. So there are very few restrictions on what you can and can't do. Now your vision will be slowly clearing. It could be clear the next day, it could be blurry the next day. There could be some double vision the next day due to anesthesia that is still present in the muscles, because when we anesthetize the eye for the surgery, we also anesthetize the muscles that move the eye. So some people may have a little residual double vision, and certainly the eye may be blurry because of inflammation from the surgery. And that will gradually clear so that usually within a week or two, vision will be at its maximum level. This is what I love to do, and this is why I show up every day, because I look forward to being in the operating room and operating. We are streamlined and optimized predominantly for cataract surgery. All of our staff is focused and tuned in to doing cataract surgery, not like a general hospital where, one room is being a gallbladder operation, and another room they're taking out a kidney, and then way down the hallway they're taking out a cataract. This is our focus, this is what we do. We want to make it as comfortable and streamlined for the patient to come in, have their surgery safely with the newest and most modern equipment, and be able to resume their normal activities and lives as soon as possible afterwards. We have a tremendous amount of experience, and we've set this center up really with the sole goal of providing the best possible cataract surgical experience. I've been doing cataract surgery over 15 years. I've invented and designed several instruments which are used in cataract surgery. I've lectured around the country, I've written articles, and still continue to teach residents how to do surgery. I do many, many cataract surgeries and have an extremely low complication rate. The eye does not tolerate mistakes very well, and I pride myself on getting the surgical procedure right the first time, not having to reoperate, and a patient's going to have their best chance of having a perfect surgical result with us here.